Are we finally winning the war against America's drug crisis? For years, the headlines have been grim, a relentless drumbeat of loss and despair. We've seen families shattered, communities devastated, and a public health emergency that seemed insurmountable. But what if I told you that for the third year in a row, the number of fatal drug overdoses in the United States has fallen? It sounds almost too good to be true, doesn't it? A ray of hope piercing through the darkness. Before we continue, if you want to stay on top of everything happening in US politics, hit that subscribe button right now and leave a like. It really helps this channel grow. Now, let's talk about the news. Newly released provisional data from the Centers for Disease Control and Prevention, the CDC, shows a significant and encouraging trend. By the end of December 2025, the provisional data indicates a 14% drop in reported drug overdose deaths across the nation, bringing the total down to 68,632. This isn't just a blip, it's the third consecutive year of decline, a sustained downward trend that offers a powerful counter-narrative to the crisis we've become accustomed to. For so long, the numbers have climbed relentlessly. We've seen devastating impacts from the opioid epidemic, the rise of fentanyl, and the toll it has taken on individuals, families, and our healthcare system. The sheer scale of the problem has been overwhelming, making any sign of progress feel like a monumental achievement. And indeed, it is. So, what's behind this remarkable turnaround? The CDC's provisional data doesn't pinpoint a single cause, but it does highlight several key areas that have seen increased focus and investment. We're talking about expanded access to addiction treatment, a greater availability of overdose reversal medications like naloxone, and a more coordinated effort across federal, state, and local agencies to combat the drug supply and support recovery. Think about it, more people are getting into treatment programs. This includes everything from medication-assisted treatment, which uses drugs like buprenorphine and methadone to help manage withdrawal symptoms and cravings, to counseling and behavioral therapies. The stigma around addiction is slowly but surely being chipped away, encouraging more individuals to seek help without shame. And then there's naloxone, or Narcan. This life-saving medication can rapidly reverse the effects of an opioid overdose. Its increased availability, through wider distribution and even over-the-counter access in some areas, means that more people are on hand to administer it when an overdose occurs. Every time naloxone is used successfully, it's a life saved. It's a chance for that individual to enter recovery and reclaim their life. The federal government has also been playing a more active role. Initiatives aimed at disrupting the flow of illicit drugs, particularly fentanyl, have been stepped up. This includes enhanced border security measures and increased collaboration with international partners to target drug trafficking networks. While these efforts are complex and face constant challenges, the sustained focus is clearly having an impact on the availability of dangerous substances. Furthermore, there's a growing recognition that addiction is a public health issue, not solely a criminal justice one. This shift in perspective has led to a greater emphasis on harm reduction strategies, which aim to reduce the negative consequences associated with drug use without necessarily requiring immediate abstinence. This can include things like syringe exchange programs and supervised consumption sites, which, while controversial in some circles, have shown to be effective in preventing infections and reducing overdose deaths in other countries. This 3-year decline is not just a statistical anomaly. It represents the potential impact of evidence-based policies and a renewed commitment to addressing the root causes of addiction. It means that potentially tens of thousands of lives have been saved, and that families have been spared the unimaginable grief of losing a loved one. It means communities can begin to heal and rebuild. However, it's crucial to acknowledge that this is not the end of the story. The number of overdose deaths, while falling, remains tragically high. Fentanyl and other synthetic opioids continue to pose a significant threat, and new synthetic drugs are constantly emerging. The fight against addiction is an ongoing battle, requiring vigilance, innovation, and sustained effort. We must also consider which demographics and geographic regions are benefiting most from these declines, and whether certain populations are being left behind. Are rural communities seeing the same progress as urban centers? Are particular racial or socioeconomic groups experiencing a more significant reduction in deaths? These are critical questions that require deeper investigation. The question now is, can this progress be maintained? And what more can be done to accelerate these positive trends and ultimately eradicate the scourge of drug addiction in America? What policies, if any, need to be reevaluated or strengthened? So what do you think about this? Drop your opinion in the comments below. I read every single one. This is a complex issue with many facets, and your perspective is vital. The data is clear: we are seeing a turning point in a crisis that has gripped our nation. The path forward requires continued dedication, smart policy, and a compassionate approach. We will continue to monitor this developing story and bring you the insights you need to understand what's happening in American politics and its impact on our lives.